Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great videos featuring the latest technology, our stellar doctors, and inspiring patient stories. Okay, you're coughing, sneezing, pain or pressure behind the face. You might have an upper respiratory infection, and kids are especially vulnerable. Joining us to talk about this is family medicine doctor Stephania Hasan. She is at the Scripps Coastal Medical Center in Chula Vista, California. Thanks so much for being with us.
Thanks for having me.
There's lots of different types of respiratory infections. Let's start with the common cold.
So the common cold symptoms can include low-grade fevers, chills, body aches, general malaise, just not feeling well. And then you can have a headache, nasal congestion, runny nose, throat pain, cough.
Just the whole gamut.
Absolutely.
All right, so how long does it last and how do you treat it?
So a common cold can last anywhere from 3 to 10 days. Usually the worst symptoms are over within 3 to 5.
And how do you treat it?
Mainly supportive therapy, so just managing symptoms for pain, for fevers, a fever reducer, pain reliever. If you're having a cough, we can use cough suppressants, and lots of fluids, rest.
Lots of chicken soup.
Sure.
What about bronchitis? What is that?
So bronchitis is an infection of the airways in the lungs. They can become inflamed. The most common cause of bronchitis is the common cold, and symptoms can include productive cough, so you're bringing up mucus, chest discomfort, tightness, wheezing, and even low-grade fevers. This is what you think of when people say, I have a chest cold.
And how long does it last?
So it can last, usually the worst symptoms last about a week or so, but you can have a lingering cough from bronchitis for 2 to 3 weeks even.
Oh, really? Yeah. And how do you treat it?
So again, supportive therapy. Because most bronchitis is caused by a virus, antibiotics don't work here. So lots of fluids, rest. If you're bringing up a lot of mucus, then we can use medications to help bring up that phlegm. Once it turns into a dry cough, then sometimes cough suppressants can help. And
then what can you do to prevent it?
So again, the things that you want to do to prevent transmission of a virus, lots of hand washing, avoiding areas where people are really sick, and then if you have any underlying conditions like asthma or allergies, making sure that that's under good control too.
What about sinusitis? What is that?
So sinusitis is inflammation of the lining of the sinuses in the face. Things like the common cold can lead to sinusitis. Also, really bad allergies can cause sinusitis.
And the treatment for that?
Again, depends on what's causing it. So if it's a virus, supportive therapy. If it's allergies or there's a bunch of congestion in the nose, you can use saline rinses to, kind of clean everything out. Sometimes even an allergy spray to help calm down some of the inflammation in the sinuses.
No spray?
No spray, yep.
No spray. How long do you take no spray for?
So usually you want to do it for a couple of weeks to notice a little bit of a difference if it's related to allergies. If it's an acute sinusitis from, a cold, maybe just 5 to 7 days.
And what about pneumonia?
So pneumonia is an infection of the air sacs in the lungs. They can become filled with fluid or pus even, and then that can cause productive cough, lots of sputum, chest pain. When you take a deep breath, you can feel a lot of pain in the chest, back pain, fevers, chills, nausea, abdominal pain, even some vomiting.
And how do you treat pneumonia?
So pneumonia can be caused by from bacteria, viruses, or even fungi. A lot of pneumonia is caused by bacteria, so antibiotics do work in this case.
And we're going to come back and talk about this in a couple of minutes. Why kids are especially vulnerable to upper respiratory infections. So just hold that thought. We'll come back and talk about that. The risk factors in general for getting an upper respiratory infection.
Yeah, so we tend to see upper respiratory infections a lot in the wintertime when people are in close quarters with each other. Hand hygiene plays a huge role. And then, of course, underlying conditions, people who have asthma or things like COPD, smoking, even air pollution, things that any irritants, exposure to irritants, chemicals, those are all things that can increase the risk.
What about an autoimmune disorder? What is that?
Yeah, so autoimmune disorders are basically where the body's kind of attacking itself. It lowers your immune system. So that can make you more susceptible to infections. If you take medications that lower your immune system, like chronic steroids, if you are on chemotherapy for cancer treatment, those are all things that can make you more susceptible to developing infections. Another common conditions include heart disease, diabetes.
And then you referenced this, a cold left untreated, it can lead to bronchitis?
Sometimes a cold can turn into bronchitis, and we tend to see that a lot in people who already have lower immune systems. It's a little bit more difficult for them to fight off the cold, and if left untreated or if their underlying conditions are not well controlled, then they are more susceptible to developing bronchitis.
And then can bronchitis lead to pneumonia?
Sometimes bronchitis can lead to pneumonia, and again, we tend to see that in patients who have lower immune systems. And on the flip side, pneumonia can sometimes cause bronchitis as well.
It's just a big basket of things, isn't it? What is pharyngitis?
Pharyngitis is inflammation of the throat, and there are lots of things that can cause pharyngitis. The common cold is the most common cause of it. That tends to be viral. When we think of strep throat, that's bacterial pharyngitis. And then, of course, things like allergies, where you have a lot of postnasal drip from the nose dripping down into the throat, causing irritation. That can cause pharyngitis as well.
So pharyngitis is your basic sore throat?
Basic sore throat.
Okay. And then the treatment of that and maybe the prevention of that?
Yeah, so treatment depends on what's causing it. If it's a viral illness, then once again, supportive therapy. This is where a lot of your home remedies might come in, your teas with honey and lemon. If it's really a sore pain reliever. If it is strep pharyngitis, that's a bacterial infection, and antibiotics are indicated for that. And then if you have allergies and you have a lot of postnasal drip, then maybe something to clean out the nose, saline rinses, or an allergy spray for the nose to help stop that.
And this one is not often heard of. It's called RSV, and I'm going to let you tell the audience what that stands for.
So RSV is respiratory syncytial virus, and it's a very common viral illness that tends to affect almost all kids by the age of 2. It generally causes mild cold symptoms, but in some kids it can cause very severe bronchiolitis and pneumonia. And bronchiolitis is a severe infection of these small tubes in the lungs.
How is RSV different from the common cold?
So RSV is different from the common cold because it has the potential to cause much more severe infections, especially in younger children. And we worry a lot about younger children because their immune systems are not as mature, as developed. And that's what can make these infections much more severe and significant for them.
And how do you treat it?
So generally it's supportive therapy. So lots of fluids, rest, a pain reliever or a fever reducer that doesn't contain aspirin. And then for kids who have very severe symptoms, those are the kids that may end up in the hospital requiring oxygen.
So how do you know that you've got RSV and that might be leading to something really serious?
So if you have RSV and your symptoms aren't getting better with supportive therapy, then you definitely want to go see the doctor.
What about cough medicine versus antibiotics to treat all of these conditions?
Yeah, so antibiotics are targeting the bacteria that may be causing an infection, whereas cough medications do a couple of different things to manage the cough. There are expectorants, which help loosen the phlegm that may be in the chest and help you cough that up. And then for a dry cough that you can't seem to control, there are suppressants to help suppress that cough mechanism.
Now, we referenced this a couple of minutes ago. Let's come back and talk about this. Why are kids especially vulnerable to these upper respiratory infections?
Yeah, so in addition to having more immature immune systems where it's more difficult for them to fight off infection, they're also more likely to contract infections simply because they're kids. They may not be very good about washing their hands. They tend to touch things and then touch their eyes, their nose, their mouth. And that's why you see it all the time on the playground. One kid gets sick, everybody gets sick.
Yeah, or in the daycare center.
Absolutely.
Or in school.
Or at home, passing it around to everyone in the family.
Everybody coughs, everybody gets a sore throat. When should you say, yeah, it's really time to go see the doctor?
So if your cough is lasting more than 3 weeks, you definitely want to go see the doctor. Also, if you're coughing up, you can cough up a lot of phlegm, different colors, clear, white, yellow, green. If the color is getting worse or you're starting to cough up blood, also want to go see the doctor. If you're having fevers that greater than 101 or they're not responding to your fever reducers, it's also probably time to go in and see what's going on.
Any final thoughts, doctor?
Basically, lots and lots of hand washing. Make sure that you have your vaccines because lots of infections are caused by, flu. There are pneumonia vaccines as well. And if you're not feeling good, go see the doctor.
Thank you so much for taking the time to be with us.
You're very welcome.
We appreciate it.
Thanks.
If you'd like more information on upper respiratory infections, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.